I wanted to escape my own identity as Daisy. I wanted to alleviate my pain. I also didn't want to be who I was. With transitioning, I could do both of those things. I could alleviate my pain and I can become someone else.
What Daisy is describing is not a deep desire to transition, to express her true identity, to be her true self. It wasn't about becoming Ollie. It was about stopping being Daisy. And that is a huge difference. Today we're going to be looking at a video from Prager U that is extremely harmful. Up front, I should tell you there are a lot of difficult topics, including self-harm, SA. If you're not in the proper headspace to deal with those sort of things, take care of your mental health. What is this video? It's called Detrans, and it's a documentary-style propaganda piece that Prager U put out to take advantage of and exploit the stories of detransitioners in order to further their agenda that there should be a total ban on all gender-affirming care, period, particularly for teenagers, because we gotta protect the children. And that's how it always goes, isn't it? We don't want to talk about the issues. We don't want to address the serious things. We just want to shout, protect the children. Which is really ironic coming from Prager U, a politically oriented organization that is a vocal proponent of both of the major risk factors for children in the United States today. It's important to bear in mind that the people we're going to see have had traumatic experiences. They themselves are not bad people. So we have to have compassion for them while we look at this. Let's do this.
Other girls looked so different than I did. They were, expressing themselves very differently.
Hey guys!
I was depressed, hopeless, and I was feeling pretty dejected and scared and alone.
This is a not uncommon feeling for teenagers, regardless of whether they're cis or trans, but it is important to note that this is a key element in Daisy's story because it goes to show how what happened to Daisy was possible. The incidence rate of people who detransition is less than 1%. The rate of people who stay detransitioned is less than 1% of that. And the regret rate for people, even among detransitioners, is lower than the regret rate for knee surgery or facial reconstruction surgery or taking out student loans. We should do everything we can to prevent as much regret as possible. But gender-affirming care helps a lot of people and definitely saves a lot of lives. To put all that aside, because of the inevitable fact that some people will regret their surgeries, is immoral and unconscionable.
I didn't like life. I just wanted to stay in my room all day. As you spiral into depression, it really feels like you're in a hole that is so infinitely deep, and the depression just was really debilitating in that I didn't really care about improving myself because I already felt like I was just I shouldn't have been born. Just having really dark thoughts.
This is another critical point to listen to what Daisy is saying. What's being described sounds like, I'm not one to diagnose over the internet, but it sounds like severe depression with proper mental health care, which is not a thing that's readily available to everyone in the United States. But with treatment, with therapy, with people addressing this issue, it likely would have not been necessary for Daisy to take any further steps in order to alleviate her suffering. It wouldn't have been necessary to try to find another outlet if what she was suffering from at the time received any kind of care. And that's important to keep in mind.
I always just felt very much like there was just something wrong with me. And I was trying to figure it out. And I used the internet to help me do that. diagnose myself. I watched a lot of trans people. I watched a lot of, gender transformation videos and saw these people really just like go from female to male visually. Like they look like men. And I was like, whoa, I didn't even know that it was possible for a woman to pass as a man that well. It's really dark when you think about it because the people who are consuming this are children.
No. So we've seen how the switch from I was self-diagnosing what was going on with me, and I came across all the social media information about trans people going through their transition and seeing the change. And then this sudden switch to this is being consumed by children. No, it's not for children. These videos, they're out there for everyone. They're being consumed by adults. The fact that Daisy and ostensibly other children are able to gain access to them, that's not intentional. They're not designed for that. And again, I can't speak for everyone else, but the demographics I have access to from my own channel seem to indicate teenagers don't really watch this kind of stuff. This isn't for children. That's a propaganda line.
Like 13, 14, 15 years old. And it's so easy for them to literally be groomed.
That's another propaganda line. This grooming thing. No, that's not what that means. That's not how that works. Again, this content is not for children. It's for the content producer and their community. It's to show their progress. I have a friend who suffers from Crohn's disease, and it made him feel weak. So he took it upon himself to go work out often. And he's been gradually getting bigger and bigger and stronger and stronger. And while, it's cool that he looks buff and whatnot, that's not the point. The point is he was making a decision to change himself so that he could feel strong, like he had control of his life. And people have been watching his progress. It's fundamentally the same thing. Your community will support you as you try to make a better version of yourself. To call it grooming it's a multiple red flags, because that word has a specific meaning. It's used when referring to a person who is trying to prepare an underage individual for a non-consensual relationship. To use it in this context is not only a gross misuse of the term, but is inflammatory. It is propaganda because it sets off alarm bells in the people watching, especially immediately following the assertion that this content is for children. It's for children. It causes grooming. Neither of those is actually true. It's just meant to inflame the viewers. We're in lie territory. It's already descended into just straight up lies.
Eventually led to me just fully transitioning. I came out to my parents as Ollie, and, I went to this, behavioral mental health clinic for like 6 days. They had a meeting with my parents, and they basically told my parents that if you don't validate Oliver, if you don't validate him, then this is just going to get worse. The best thing that you can do to help him is to accept him as your son. But I already felt like I wasn't what my mom had expected. And for me, transitioning was the closest I could come to myself without actually doing it.
That right there is the most important line in this entire video. What Daisy is describing is not a deep desire to transition, to express her true identity, to be her true self. She's describing an effort to get away from her existing identity, transitioning into Ollie, into being a different person entirely, was a way to stop being Daisy. It wasn't about becoming Ollie. It was about stopping being Daisy. And that is a huge difference.
With all of these mental struggles that I was having, not knowing how to make sense of it on my own, and consuming so much of the trans narrative, hearing people say this made me so much happier.
Yeah, people saying they're happy, that's not a narrative. That the fact that many people say that doesn't mean it's a narrative. No one's being paid by big pharma to pretend to be trans in order to convince other people to go through procedures. That's not how that works. This is more of the propaganda seeping in. This idea that a person needs to obliterate their pre-existing self in order to become a new, happier self, that's not the same as being trans. You can go through a kind of personal transformation in a number of different ways, but this is the option that seemed available to Daisy. And I would additionally posit that the way Daisy was describing her pre-transition life, hating her life, wishing she could end that state of being, so on and so forth, it could very well be that transitioning did actually save her life. Because without that escape hatch, without that alternate identity to escape into, even without being trans in the way we normally think of it, transitioning anyhow, that enabled her to get away from that desire to terminate her own ongoing existence. Even though it's not ideal, that's still an important factor, because regretting it later, changing back later, fantastic. I'm glad she has a happy life now. That's the entire point, is allowing people the freedom they need to have a happier life, to stop suffering. But that period of transition, that gave her time to work through that, to come to terms with who she really is, instead of having to face that constant pressure of needing to escape being Daisy. So she was able to make the choice to go back to being Daisy later.
This alleviated my pain. I wanted to alleviate my pain. I also didn't want to be who I was. So with transitioning, I could do both of those things. I could alleviate my pain and I can become someone else.
That's it right there. Alleviate the pain, become someone else. Not become my true self, but escape being who I was, that person who had so much pain. These are not the same things at all.
I wanted to escape my own identity as Daisy. I wasn't just playing around anymore. I wasn't just playing dress up anymore. Like, I was actually going to become a trans man and live my life that way.
Notice the sad music, the piano playing, all these other emotionally manipulative tactics. But also notice what Daisy said. I wasn't just playing around anymore. I wasn't just playing dress up anymore. These are more indicators that what Daisy was going through wasn't a matter of becoming more true to herself, but escaping who she was. And she even says it outright. It's important to keep that in perspective as we go on.
It was around middle school. I was surfing YouTube one day, and a video popped up, male to female, and allowed me to be caught by the ideology that eventually led me to hurt myself.
Caught by the ideology.
Just wanted an answer to be given to me on who I was, and I went to see a therapist, and I had only asked, I think I might be trans, I don't know, I want to know.
So this is another important point that gets a blow by and not actually paid attention to. He was surfing the internet and came across these videos and exposed to the ideology and whatever as a middle schooler, when people are still figuring out who they are and what's going on with their life. So he goes to a clinic and sees a therapist and says, I may be trans, but I don't know. There are people who only realize they're trans later in life, like in their teenage years. But that's not typically the case. I can't speak for all trans people. I don't know all trans people. But the trans people I've spoken to, the overwhelming majority, either always knew or figured it out in early childhood. By the time they become teenagers, they're simply insisting on who they know themselves to be. Exactly the same way you cis folks know your gender identity. It just happens to match the one you were assigned at birth, but you know who you are. We know who we are the same way. That doesn't necessarily mean that it's impossible for a person in middle school to come to that realization. It's an indicator that you should pay a little bit more attention to this particular person and help them make sure before they do something irreversible.
The therapist, immediately on my first appointment with her, said, yes, I am a transgender woman. She had my letter to transition the same appointment. After that, I just took everything slowly.
We cannot rule out the fact that there are doctors who don't do their jobs very well, who just confirm whatever people say and just rush them right through the process. That absolutely is a problem. It doesn't happen often, but it should happen 0 times. It's something that needs addressing. But the fact that that happens does not mean that every single person should be denied all health care because of the risk that the doctor providing it might suck at their job.
I just woke up one day, looked at myself in the mirror, and asked myself, what the heck am I doing? Because I realized no matter if I would have gone every surgery, continue with hormones, I realized I would have never been a woman. At best, I would have been a caricature of what I believed a woman was.
This is another common talking point. Being a caricature of what you think you should be, whether trans or not, is not healthy. If a person grows up thinking this is what a man is and I have to live up to this expectation and these stereotypes, it's no better. They're still not living who they are. They're living what they think they're supposed to be. So this isn't a problem with transness. It's part of the human experience that everybody has to deal with when they are in a situation where their life is not lived on their own terms. It's extremely unfortunate, and I have a ton of sympathy, but that's not actually a trans problem.
I just socially detransitioned, got the implants removed. So I had technically developed gynecomastia. My chest is not like it used to be. And
For anybody who's not familiar, gynecomastia is when a male has developed mammary tissue, actual breast tissue, and it's often surgically removed. Mr. Garcia here had his implants taken out, but also had real breast tissue in there that then had to be removed. That does happen to cis men, though. Frank Turek comes to mind, who had to have chest material removed. Human bodies aren't perfect. We do what we can. We try to improve things where possible. We set bones. We make glasses with corrective lenses. We create prosthetics for people who are missing limbs. Cis women who get breast implants, or cis men who get pectoral implants or bicep implants. These are fundamentally no different. They're cosmetic alterations that make the person feel more secure in who they are. Again, not to put down or sweep aside Mr. Garcia's story. He absolutely deserves a fuck ton of compassion for all the shit he's had to go through. But to pose these things as reasons that trans healthcare should be denied is absolute bullshit.
I have scarring, numbness has been taking a major toll on me since I've realized what I've done.
Seemingly out of nowhere, we've suddenly seen a huge spike in media depictions and social media depictions.
This is the attorney for Chloe Cole. She represents a couple of well-known people who are famously detransitioned and are now mouthpieces for the Republican Party to push this agenda prohibiting trans people from being able to access healthcare, particularly adolescents, when it's most meaningful, and to restrict the rights of trans people to exist.
Of transgenderism. It's even reached the mainstream. And I think this is all coming to a head and what this really means for our society.
Notice the slippery slope, the implied slippery slope. The message is exploding, the ideology has reached the mainstream. Take what she's saying and change the word transgender for the word African American and see if it still sounds reasonable.
the case of Layla Jane, a young girl whose breasts were removed at age 13. Layla Jane experienced a host of medical issues in her youth. Her mother, who is bipolar, expressed to these physicians and therapists that her daughter might be bipolar, but she actually never received any diagnosis or treatment for that.
Similar to Daisy's case, clear signs of mental distress that needs treatment that was never received. Again, not to put down or put aside what this person went through, the malpractice of her physicians, the inability of her situation to bring her the healthcare she actually needed, are not trans issues. Those are American issues. Those are politics issues. And frankly, it's disgusting that the very people who put her in a situation where she could not get the health care she actually did need and made it necessary for her to go through these hoops and meet with these incompetent doctors who did harm to her, the same people who put her in that position are now exploiting her to force other people into bad positions. That is fucked up.
One physician who, after less than a 2-hour appointment, green-lighted the hormone therapy, and in a similarly or even shorter period of time, a plastic surgeon signed off after one visit on removing her breasts.
Weasel words. One physician greenlit hormone therapy after a 2-hour session. That sounds like super quick. The point of this particular visit was to ascertain whether or not Layla would benefit from hormone therapy. Initial hormone therapy is largely not harmful and for the most part easily reversible. It's fairly low consequence. But then she goes on to say the plastic surgeon signed off in a similar type of meeting. Notice we get specific details on the one and the details on the other just hand waved away. Also, I haven't been able to track down anything outside of court documents about her story. So, if she did in fact have a double mastectomy at 13, she would be the youngest person that I can find any record for existing who had such a procedure at that age.
It's likely that if physicians had properly diagnosed all of the issues present in Layla Jane as a child, she would never have gone down this path.
I agree on that point. It is likely, or so it seems to me, from an outside perspective, that if all of her existing issues had been properly treated and diagnosed, she would never have gone down that path. That, again, is not a trans problem. That is an American healthcare system problem. And again, it's really, really gross that the people who are denying healthcare and access to the treatments that could have helped her are now using her story to justify hurting and denying access to healthcare for other people. It's so gross. I don't even have words for it.
When parents of trans-identified kids are referred to specialized gender clinics, they're often told that they're going to get comprehensive, multidisciplinary mental health assessments.
No. Maybe some people are hearing that, but I've never heard it. I've never heard of anyone who's heard it. That doesn't make it true that it's not happening, but he's laying it out like it's universally true. I don't see a world where anyone would ever say that, because you don't go to an eye doctor for an eye infection and he gives you a prostate exam just in case. That's not what you're there for.
In practice, these kids were put on a fast track to medical transition.
That's an important point. Some individuals, like Chloe Cole, have been fast-tracked, and wrongly so. There were signs that were missed, there was care that was missed, there were underlying conditions that were missed. These things should not be fast-tracked. I absolutely agree. But to completely shut down the ability for people to get health care, especially teenagers who need it the most, on the grounds of the malpractice of a few individuals, is absolutely abhorrent. If we shut down open heart surgery on the grounds of the small number of surgeons who have screwed up an open heart surgery. A lot of people would die. We don't do anything else in medicine that way. But this issue is super politically charged because the people who have power and want more of it are able to leverage it to get votes. And that's disgusting too.
Prisha Mosley. I was a 15-year-old girl when the trans community found me. Already diagnosed with multiple mental illnesses, including anorexia, a body dysmorphic disorder, and borderline personality disorder, a trauma disorder, I was easy to manipulate and convince that I had been born in the wrong body.
Here's another case of a person who had numerous mental illnesses. And then, as she describes it in her written testimony, the trans community found her and was able to convince her. I don't know what that's supposed to mean. There isn't a description of how this finding happened. Is there a trans talent scout who came out and said, you could join our team. It'll make your life so much better. Whatever the case was, we don't know. We don't have details. And once again, not to put down her experience, she has been through struggles and traumas and horrible, horrible situations. And she deserves our sympathy and compassion. That said, the fact that she describes herself as a person who is very easy to convince of things that are not true, one must question if what she is saying today is not something that she was convinced of that is not true by an outside source.
I was told that this was the reason for all of my mental and emotional distress.
The gender specialist I was taken to see told my parents that I needed to be put on puberty blocking drugs right away. They asked my parents a simple question: would you rather have a dead daughter or a living transgender son?
Chloe's used that line a lot. It has a lot of emotional impact, doesn't it? That's the point. It's not impossible that Chloe's doctor may have said that line, but Chloe's weaponizing it every bit as much as this unscrupulous physician she speaks of. And again, the fact that she, and I have tremendous sympathy for the situation, the fact that she had a bad doctor does not mean every doctor is bad.
This is the moment that we all became victims of so-called gender-affirming care.
But is this the document we're talking about? You needed this letter signed by a therapist to open up the door for you to get these medical treatment. Is this the document that we're talking about earlier?
Yes, it is.
And it took you how long to get this?
30 minutes.
We're featuring a bunch of people who seemingly managed to speed run transition, or at least that's the way the case is being laid out. As Chloe referred to it, so-called gender-affirming care, which again shows a strong political bias. The scientific data, the medical studies, again, many of these studies, including the ones Prager references in this propaganda film, are linked in the description. The science is very, very clear. It does save lives. It makes a huge difference to people. So to call it so-called, to paint this picture that everyone can just speed run this with no oversight or no forethought is absolute fucking nonsense. Maybe some people did slip through the cracks. Again, it's from Prager, so we cannot take it at face value. And some of this stuff is really hard to verify, but it's not unthinkable a few people slipped through the cracks, and that's really unfortunate. Functionally, it's not all that different from a veteran patient slipping through the cracks at the VA and gaining a staph infection. I knew a person like this. He's since passed away. He had to have a quadruple bypass surgery. The surgery went okay, but he had to be on a ventilator during the surgery and shortly after. The ventilator was not properly cleaned. Contaminated material was inside it and gave him a staph infection. He survived it, but it messed him up for a long time. It was a very difficult situation. The fact that that happened, that somebody dropped the ball, does not mean that all bypass surgeries should be canceled. That would be really, really harmful. And yet that's exactly what we're discussing. That's exactly what's being proposed, both in the United States Capitol building and in state capitals all around the country.
The ideology that has become dominant at these clinics is that trans kids know who they are, and therefore to question them, to ask basic therapeutic questions like, could your gender dysphoria or gender identity have been triggered by some other event in your life? Basic questions of screening.
Notice that none of the people we've heard from so far expressed gender dysphoria. None of them even mentioned it. They were in bad situations. They were depressed. They were suffering from mental illness, whatever the case may be. Not one of them even entertained the idea that they were not the gender that they should be, that they were born as the wrong gender, or their body doesn't match their identity. These things have never even come up. So, yes, there are people who are being given treatment that is not right for them, but that's not what he is talking about.
But the truth is that parents don't have much of a choice in the matter. And doctors are telling parents in front of their distressed children, if you don't consent to the use of puberty blockers and cross-sex hormones, your child is going to die by suicide.
No. Very much no. Very much no. There is a ridiculously high rate of self-harm among trans teens, especially those who are not able to access gender-affirming care. The best data I've been able to find indicates that that rate tops out at about 40%. There is no way a doctor who knows anything about this subject would tell a parent, especially in front of the child, that if you don't do this, your child will commit self-harm. There is definitely a higher risk. But even saying that in front of the child is highly unlikely. Saying something that is patently not true in order to push the parents into assenting to something like that is just so far beyond the pale. It's just frankly unbelievable.
I believe that most doctors who practice gender-affirming medicine,
Their gender dysphoria.
they genuinely, sincerely believe that they're doing good, but they're not.
Some of them are not. Some of them are in a rush, or they don't care, or they're just not good at their jobs. But to broad brush all physicians who practice in this field as being harmful, regardless of their good intentions, is, let's call it irresponsible, to be charitable.
The current cohort of teenagers that are being transitioned under the affirmative protocol, which lacks guardrails.
I tried to look up the affirmative protocol. I could not find it. What I could find was the affirmative approach, which is a guideline which tells physicians, particularly physicians who are not well versed in dealing with transgender and gender dysphoric youth, to allow them to assert what they feel they need to assert and refer them to a specialist. Don't contradict them, especially if you don't know what you're talking about. Send them to a specialist, just like you would with any other disorder, disease, complication, or medical situation that is not in your own wheelhouse.
Which takes kids at their word when they say I'm trans. Double mastectomies on teenage girls went up 13-fold between 2013 and 2020.
I want to call your attention to the citation at the bottom here. Continuation of gender-affirming hormones among transgender and adolescents and adults. That's one of the papers that's referenced in the description. This article doesn't say anything that he's talking about right now. This article is a secondary analysis of medical and pharmacy records in the U.S. military healthcare system from 2009 to 2018. All this study talks about is people continuing to use gender-affirming hormones over a long period of time. And that's all they had access to. We don't know how many of them went on to get any kind of surgeries. We don't know how many of them fully transitioned, detransitioned, or even how they identify. All we know from this relatively small sample of people is how many continued to use the hormones after a 4-year period. That's it. And here he is talking about how rates of this are 13 times higher and all this nonsense. That's not anything to do with the paper he's citing at all. However, there are other papers. There is a paper by Jack Turbin. They sampled 27,000 people and some change. And they found that the vast majority of the people who transitioned did not detransition. And of the few who did detransition, it was temporary. We're talking in the range of 1% detransitioning, and a significant fraction of those who detransition temporarily eventually retransitioning when they're in a better state.
Between 2016 and 2019 alone, these procedures went up by 500%. A study published in 2022 by researchers who are advocates of gender-affirming surgeries showed that the youngest patient to have received a radical bilateral mastectomy in the United States is 12 years old.
That is a lie. That is not what that paper says. That paper, Tang et al., the part that he's citing, they were referred at age 12. They were not subject to surgery at age 12. The paper does not say at what age they received surgery, just that they were referred and the process begun. Surgery, of course, often comes after at least a couple of years of hormone therapy, but that's not addressed in this paper. This is just the age of referral. But it is worth noting, this paper does go on to say, the incidence of gender-affirming mastectomy did increase 13-fold, as determined by the number of people in the database at the time of the referral. They explain their methodology thoroughly. And again, this paper is linked in the description if you care to read it for yourself. Of the whole period, 209 patients underwent surgery. The incidence rate of complications were hematoma, 3.6%, infection, 2.9%. Two patients, less than 1%, had documented postoperative regret, but neither underwent reversal of surgery. Two patients had regret, and neither one, so much so that they had the surgery reversed. So what he just said is absolutely a lie.
These kids are going to grow up and they're going to start to feel the full effects of their medical decisions. They're going to start to feel the side effects.
They're going to regret it. It's fundamentally the same thing as telling a person, oh, well, you don't want to get a vasectomy now, or you don't want to get your tubes tied now, because what if you want children later? You'll regret it. You don't fucking know that, and the data shows that almost no one does regret it. So fuck off with that.
You don't have to remove your body parts to make you complete.
Now we go into more emotionally manipulative language that doesn't actually say anything. You don't have to remove your body parts to be a whole person. I tend to agree. As I have said previously, you don't have to get surgery to be a trans person, to be the person you have always been. You don't have to have hormones. There is no bar you have to clear. There is no gate you need a key to unlock to gain access to being a trans person and living your life as your truest self. You do not have to do these things. If you do, they're there for you, not because you owe anyone any kind of presentation. She's not wrong, but not for the reasons she thinks.
When I transitioned, my suicidal ideation did not go away. My name is Camille Kiefel.
My name is Emily. My name is Laura Becker.
My name is Abel Garcia, and I am a detransitioner.
And that's all we get to hear from those people. They're people, they detransitioned. From what little we heard from them, it seems that they were suffering from suicidal ideation. Again, that is a mental health access issue. That is not a trans issue. It's probably, based on what information we have available, that there are more people like Daisy who had self-harm ideation and had no access to any other way to deal with it than to create an escape hatch by ditching the entire identity and becoming an entirely new person. That's an abuse of gender-affirming healthcare. I don't blame the people who went through this because it was the only option they could get their hands on. But that's not what that healthcare is for.
It's probably not really a good thing that I was able to get my hormones so easily. I mean, anyone can go in there.
No. I mean, it's possibly good, possibly bad that Daisy was able to gain super easy access to hormones in order to affect the change into Ollie. I don't know how easy it was, but I do know that I haven't, and no one else I know has been able to just order the hormones online or just gain access to them, just have them handed over. That's absolutely ridiculous. There are so many steps you have to go through, and it's so expensive. And the process is, I mean, there's a reason I haven't done it. If it were so easy, me and lots of others like me would have done that. It's either a blessing or a curse for Daisy, but that's not the typical experience. That is an extremely rare exception. Much like the person we saw giving testimony earlier who talked about a 30-minute speed run to get a form signed. Good for you, but that's not universally true. You're the exception, not the standard.
Not only did they send me home with the hormones, but I actually did my very first shot right there in the doctor's office. And I was just euphoric, and it was real, and I was actually going to start seeing changes, and I was going to start passing, which basically meant that everyone around me was going to see me as a boy, an actual boy. This feels good. This makes me happy.
That's as it should be for a trans person. But that's also what you would expect from the situation that Daisy has described, where she was trying to escape her existing identity. She was going to be a different person. The fact that she was able to utilize gender-affirming care possibly saved her life, even though she ended up not being a trans person. But again, that's not what transgender care is actually for.
Everyone's calling me Ollie. Everyone sees me as a guy. But then, looking in the mirror, I'm like, what did I do? Like, I start getting these like really scary thoughts of like, you're incomplete. You're not a guy.
This is not uncommon. Trans people often struggle with imposter syndrome. I'll never pass. I'll never be the real thing, and so on and so forth. And this is true for people in general. You're never going to be enough, or no one really likes you. It was fortunate for Daisy that she was in a situation during her transition where people were largely supportive, where people respected her name choice, her pronouns. She doesn't seem to have any complaints about that. So that's to the good. But then to go through this period where she's questioning, where she's not sure if she's done the right thing, that's natural, that's normal. And again, you're looking at someone who was going through their teenage years. That's not abnormal for any teenager.
You finally have expressed your true inner self or whatever, the thing that you wanted to do so badly ever since you were like 13, 14 years old.
The finger quotes around the true inner self, that's bad enough because it shows derision towards that idea that a person can have a true inner self, that you can be anything other than what you're told to be by society. That's not great. That's not good. But then to say who you've wanted to be since you were 13, 14 years old. Now, again, I'm sure there are trans people who only figure out they're trans around that age, but it is a big red flag because it shows that it's not something you've always wanted. It's not a response to a sense of gender dysphoria or not associating your gender with your own actual identity. This was never about Daisy's gender.
You did this thing to alleviate this gender dysphoria, that wasn't there before, but you made it into a problem, and now your body image issues are worse. That's not supposed to happen. What do we do now?
I should point out that it is actually very normal for a person going through a transition to experience periods where they experience increased dysmorphic feelings. Their sense of their body is even further off than it was before.
I was almost 5 years on testosterone. So if I had gone further, I wouldn't have been able to go back. When I found out I was pregnant, I was just over the moon. I mean, I was scared I was going to have a doctor tell me that, like, sorry, you're infertile, and it would have been my fault.
So what Daisy's referring to there, it is possible that by being on hormones for a number of years, a person could render themselves infertile. That's what Daisy's talking about. Daisy could always detransition, the same way a person at another age could transition from male to female, the same way a person would transition from male to female. What she's talking about, this going back business, is a reproductive capability, which is another topic entirely tied in here because of the emotional manipulation. What if you were sterile? What if you discovered you couldn't carry a baby? Yeah, that sucks. I had to live through that too. It's very fortunate for Daisy that she did still have her reproductive capability. But that's not the same as not being able to go back. She could always go back.
There are so many young people who are going through very similar things that I did and are still being told that transition will save them. And it's just not true.
Because it wasn't true for Daisy does not mean it's not true for anyone else.
My story is tragic in some ways, but it's very redemptive in many ways. That cannot be said for many detransitioners. And that's just heartbreaking. Like, I can't imagine living with that. Like, I can't imagine what it would be like to regret a bottom surgery or, you know, to be infertile because when you were a little child, like 12, your, you know, parents were manipulated into putting you, like, blocking your puberty.
Daisy's not a physician, so I don't expect her to understand the ins and outs of all these things. Puberty blockers are for temporary use. They're intentionally for temporary use. They can cause long-term damage if they're used for too long. The point is to buy the child time, precisely so that doctors can figure out if this particular child truly is a trans child or has other things going on that need to be addressed, like what Daisy was talking about, self-harm ideation, crippling depression, other things that should be addressed. And if someone wants to say, we absolutely should give kids, particularly trans-identifying kids, more access to healthcare services, to mental health care services, if we should give them the ability to get other things treated, yes, we should take care of those other problems as well. Yes, we should make sure those other problems aren't driving the person to a process, a procedure, a series of steps that will change their body and their life if that's not what they actually need. That's not how it operates in the United States. You aren't granted access to mental health care or any other health care by default, which is why there are so many people with untreated mental illnesses of all kinds running around the world today, not just teenagers, but adults. And the state of our society makes it very, very clear why that's a problem. Denying access to healthcare to other people because Daisy had a bad experience is beyond irresponsible.
Here's the deal. I'm detransitioning. It's true. It's not a joke. I was something because people were reacting to me, but it was a me that wasn't really me. So I was protected. I was protecting myself with the trans label.
That's an important thing. That goes back to what we were originally talking about from the very beginning. Daisy wasn't trans. Daisy was using being trans to create an alternate identity to escape being Daisy, not to be Ollie. Daisy herself made it clear from the very beginning, but it has to be pointed at because of the way Prager laid out this deceptive propaganda piece to mislead people and emotionally manipulate the viewers into thinking what they want to be true rather than what actually is true, we have to point it out that even Daisy expressly states she was never a trans person. She transitioned for other mental health reasons.
My name is Daisy, and I am a woman.
Overall takeaway, this is frankly disgusting. Once again, I will state I have endless sympathy for the people who went through this. A lot of the things they had to go through, I've had to go through myself. A lot of the things they've gone through, I've never gone through. But that doesn't change the fact that I feel for the suffering they've had to endure. But then Prager comes along and says, we want to tell your story so other people don't have to be hurt the same way you were. And so they say, okay, and they tell their story. And then Prager puts together this video and manipulates it and changes it and twists the stories and brings on experts to lie about the data and present misleading information in order to create an overall narrative that gender-affirming healthcare, particularly for teens, is somehow harmful, when the truth is the exact opposite of that. We do need more accountability among healthcare providers of all kinds. We do need higher professional standards so that people don't get rushed through systems and drop through cracks. But to deny an entire group of people at high risk healthcare that they need on the basis of a smaller percentage of people who regret having gone through the process than practically any other medical procedure, from knee surgery to open heart surgery, is absolutely insane and is absolutely inexcusable. Now I'm going to open up the room, and anybody who has questions, anybody who has additional thoughts they'd like to add.
I was definitely taken aback by what was said. They're using people's knee-jerk reactions. They said I was bipolar. They gave me antipsychotic drugs that might have helped the bipolar person. I was not bipolar. They did not help me. They made my life miserable for a few months. That doesn't mean bipolar people don't exist, or that treatment might work, or another one might not work for them. And I see it as the exact same thing. These people were possibly diagnosed with something they didn't have. It doesn't mean trans people don't exist or that trans affirming care shouldn't be done. And if it weren't for the push to vilify people like yourself and many others, it wouldn't be an issue.
Did you know that you can walk in to any doctor's office and fake the symptoms for any internal medicine illnesses, fake those symptoms and get treatment for that illness? Did you know that you can do that? It does not mean that the illness that you're faking isn't real.
Bad information from a doctor given to a person doesn't discredit the whole area and the whole medical area and what the purpose of Daisy's story should be. It's not the message that Prager U is trying to spread.
That's what really pissed me off about this. Like, I get that Prager U is going to lie and be deceitful and exploit people for their own agenda, and all the while accusing their political opponents of having an agenda. Like, the trans agenda is, let us exist, please. Maybe don't kill us in the streets, please. But then to take these stories and exploit them in that way and present such a misleading picture, such a one-sided interpretation specifically for the purpose of doing harm to people, it's unforgivable, really.
And then to take it and exploit it to cause harm to a whole nother group of people is pretty sickening.
They're like, oh, Bill, we're just talking about the kids. No, you look into these bills, they are targeting adults. The bill that passed in Oklahoma last February said that your insurance company could not pay for your gender affirming care, no matter whether you were an adult or a minor. The insurance company was not allowed to cover that. I'm sorry, Daisy. I really am that you went through what you went through, but sit the fuck down. You're telling people that because you can fake having a condition, real people can't have that condition. It doesn't mean the symptoms that you're experiencing or that other people can't actually have those. That doesn't mean that people actually can't have that condition because you can fake it. Shut the fuck up and sit down.
That's all for today. If you like what I do and want to see me continue to do it, there are a few ways you can help. First is Patreon. That's probably the best way. Next is YouTube memberships. You can also send super chats, gift memberships, or super thanks. Those are always appreciated. Or, if you want something physical for your support, you can check out my Spring Store, with some items available directly through YouTube, and the full inventory on betterthanreligion.com. The links for everything are in the description. Thanks for watching.